Did you know that chronic pain is the most expensive health condition that we face as a society, affecting more than 1 in 5 people, and exceeding the combined costs for the treatment of heart disease and cancer and over 3 times the cost of what we spend for the treatment of diabetes in our society? To date, the vast majority of the Western population has only had legal access to 2 broad classes of analgesics, that is, low levels such as Tylenol or aspirin, which are often ineffective at treating moderate to severe pain, or opiates, which are significant at numbing the body but unfortunately wrought with serious adverse consequences, including the risk of death, and unfortunately driving America's leading preventable form of death. In this video, I'm going to explain what happens when people that are used to using opiates for treating their chronic pain decide to start using cannabis. Welcome to the planet's premier medical cannabis education channel, unabashedly brought to you by the University of New Mexico's Medical Cannabis Research Fund. Now, even though people have been documenting the analgesic usage of cannabis for, well, millennia, describing its effects as similar to that of opium, but without the gastric intestinal disturbances, our government has largely failed to provide us objective information on the true effects of using common and commercially available cannabis products for the treatment of pain. In fact, our team conducted one of the first, if not the very first study in the United States addressing the question of what happens when chronic pain patients that are used to using prescription opioids decide to start using cannabis. So here's what we did. We took chronic pain patients who were all habitual opiate users for the treatment of the pain and all given the authorization to enroll in the New Mexico Medical Cannabis Program. Now, some of the patients chose to take advantage of this opportunity and to start using cannabis for the treatment of their pain, while other patients declined the opportunity and continued their opioid regimen. In other words, we had the opportunity to not only measure how cannabis usage might affect chronic pain, but also to measure how the decision to start using cannabis might affect people with chronic pain. To say the least, the results were striking. Compared to the non-cannabis users, the patients that decided to enroll in the cannabis program experienced a 5 times higher odds of reducing their opiate usage by the end of the 21-month observation period. And get this, the cannabis users actually experienced a 17 times higher odds of ceasing the use of opiates altogether. In terms of raw numbers, while only 45% of the non-cannabis users reduced their opiate usage to some degree, over 83% of the cannabis users reduced their opiate usage by the end of the observation period. Perhaps most startling, while only 3% of the non-cannabis users ceased the use of opiates by the end of the observation period, over 40% of the cannabis users eliminated the use of prescription opiates altogether. Moreover, the cannabis users claimed that the cannabis caused them to experience lower daily pain levels, higher behavioral functioning, and higher quality of life. Needless to say, the results were clinically and statistically significant. So what can we learn from this study? Well, for one, cannabis is an effective treatment for chronic pain. 2, when patients are given the legal opportunity to access cannabis, they often substitute their prescription opiates in favor of using medical cannabis. In addition, our results suggest that cannabis may be an effective treatment for opiate use disorder. But you're going to have to check out our other videos to learn more about that. So if you are one of the tens of millions of people out there dealing with chronic pain every single day and trying to decide whether or not to experiment with medical cannabis, well, I'll just leave that up to you. As always, don't forget to hit the like and subscribe buttons. Please consider becoming a patron for this channel, and also please consider becoming a donor to the Medical Cannabis Research Fund, sponsored by the University of New Mexico, where we are bringing you a wealth of information and fighting on the front lines of science every single day to bring you straight, objective information so that you can make the best medical decisions for yourself and for your family. Together, we are changing the world.